doing the eye portion of the exam.
Good morning, my name is Alex Sanchez. I'm a PhD student taking care of you today. Can you just confirm your name and date of birth for me?
Yes, Michael Anderson, 12/21/1990.
Perfect. Do you know where we are today?
Yeah, we're in the clinic.
Perfect. Do you know today's date?
10/17/2024.
And do you know the current president?
Joe Biden.
Perfect. So patient is alert and oriented times 3. What brings you in today?
Just to establish care, first time here.
Perfect. So since this patient is here to establish care, we're going to do a comprehensive physical exam just to establish that we have his medical history as a baseline for future visits. Patient is alert and oriented times 3. No apparent distress, well developed, well nourished, appears his stated age, normal gait and motor activity, good hygiene, no apparent bad breath or body odors. Okay, so today we're going to start with our vitals. We're going to take his blood pressure using this blood pressure cuff. It's called a sphygmomanometer. We're going to use this on his arm. So due to privacy reasons, we are not going to be taking off his clothes. However, we will be just using it on top of his arm with his clothes, just like this. So we're going to begin with palpating the brachial artery. So do you mind just making a fist for me? Not fist, I'm sorry. Please flex your bicep. Thank you very much. Side of his arm, we're going to be looking for the brachial artery and looking for the brachial pulse. So if you mind just flexing for me, perfect. We're going to be looking for the brachial tendon and going just medially right here. Perfect. It looks like we can feel the pulse. And perfect. So we're going to put his arm down. We're going to begin by putting the cuff to make sure it's over the brachial artery. So what we do is, using the blood pressure cuff, we make sure we align with the correct arm. This is the right arm. We're going to put it right over where we felt the... Sorry, can I just ask you to hold your arm up like this? Perfect. We're going to put this right 2 centimeters on top of his antecubital fossa where we felt the brachial artery. So we'll put it right here. All right, perfect. So usually we can hold the patient's arm, or we can have it rest on the table. I will be holding it for this exam. So before we begin with our stethoscope, we're going to find the radial pulse and make sure that we inflate the cuff until we don't feel his pulse anymore. And then we add 33 millimeters per mercury to know where to establish our baseline for reading the meter. Sorry, I'm just gonna make sure it's at heart level right here. We look for the radial pulse right over here by his thumb. Perfect.
It's just testing.
So we notice it at 120, we're going to add 30, and that's where we're going to inflate, so make sure that we can hear our Korokov sounds. Just going to get positioned a little bit better. Okay, based on our first Korokov sound and our last Korokov sound, we got a reading of 123/85. All right, so to begin our skin exam, we're going to inspect first, as always, and then we'll be palpating the skin to check for different things like color, moisture, temperature, texture, and any mobility and skin lesions as well, if there's any presence of any suspicious growths on the skin as well. So usually in a clinical setting, we would have our patient be in a gown, and then we would reveal each part of the body that we would be inspecting as we get there. But unfortunately, due to restrictions of our simulation, we won't be doing that, and we'll just be hovering and showing you exactly how I would be doing it on a normal patient. So to begin, we're just going to make sure that we check the skin in both. Can you just stand up for me? Yeah. Perfect. So we're going to make sure that we check the skin on both the front and the back of the patient. So we're just going to look around. Looks good. We're going to look at his hands. So we're going to inspect the skin. Color looks great. Moisture looks pretty. Let's check the moisture really quickly. Moisture is perfectly fine. Color is appropriate for ethnicity and race. Temperature, using the back of the hand, we make sure that it is normal, within normal limits. And texture it's about between rough and smooth. Mobility, we're going to check for turgor. We're going to just pinch the skin and make sure how quickly it goes back. This is an indication of hydration of the skin as well. And then usually when we check for any skin lesions, we would just go through our A, B, C, D, E, F, G. So for the next part of our exam, for the hair, skin, and nails, we're going to be observing the hair, doing the tug and pull test, as well as we're going to combine it with the peripheral vascular system, where we can also inspect the head for its contour and shape and make sure that everything is looking perfectly good. So let's start with his hair. We're going to observe, make sure that everything looks normal. We're going to part the hair and make sure that there's no sign of male pattern baldness, any alopecia, anything of the sort. Then we're going to perform our tug test, where we're going to grab some hair, and this is going to check for the fragility of the hair And if we pull it out like this, it came out negative, perfectly normal for his hair texture and hair durability. Next, we're going to be doing the tug test, which is going to be tugging a lock of hair, pulling it lightly, and seeing if there's any hairs. We had one, but positive would only be 6 or more. All right. So now on this part, we're going to be checking along the sutures, making sure there's no abnormalities. Here we went through the coronal suture. Here we're going to go through the parietal suture, our squamous, our occipital, making sure everything's right. So we would say this is normal cephalic and atraumatic. The next part of our exam would be the nails. We're going to begin, just as always, with inspection, then palpation. So, I'm sorry, Michael, thank you. I just want to see your nails. So what we're looking for here is we're going to check the pigmentation, the length of the nail, the symmetry between both hands. I'm sorry, can I just make sure I have them all both right in front of me? Any ridging, beating, pitting, or peeling. We're just going to observe the cuticles for its color, its vasculature, its integrity, which it looks great. Now we begin the palpation step, which we're going to check the proximal and lateral nail folds for any redness, swelling, any breakages in the skin, because we know that any breakages in the skin puts us at exposure for any paronychias. Just going to check each finger to make sure everything's normal. Alrighty. Looks great. Now our next, this is going to check for redness, swelling, any exudates, any growths, warts, cysts, or tumors. The nail plate, we're going to check them all as well. All right, we're checking for firmness, any thickness, making sure everything's uniform, and making sure everything's adhering to the nail bed as well. Alrighty. If you notice, I'm also doing a capillary refill test where we check for blanching. If you want to just check right there, the blanching, making sure it lasts for 1 to 2 seconds, that means it's normal. And another test that we're going to be checking for is going to be for clubbing. Can you just put your fingers like this for me together? Perfect. So this is going to indicate that this is a normal indication. This is going to show he has no clubbing. Usually the base of the nail bed would be angled out and they would be touching each other. An exam that the skin is warm, dry, intact without any rashes or lesions, normal turgor mobility, appropriate color for the ethnicity and race of the patient, and no pallor, cyanosis, or signs of jaundice. The nail beds are pink with no cyanosis or clubbing. Capillary refill was less than 2 seconds on all 4 of our extremities. So we checked only his hands, but usually we would also check for capillary refills on his toes as well. So our next exam would be the peripheral vascular exam, where we check the extremities, such as his arms, his legs, and we're just going to be making sure that everything is within normal limits. Now the next part that we would check would be his pulses, which would be the radial pulse, the ulnar pulse, and the brachial pulse. The brachial pulse we already felt palpated in the during vital signs, so we're only going to be checking for the radial and ulnar pulse in this exam. I'm sorry, Michael, can I just see right here? I'm going to put up his sleeve a little bit along the thumb. This is where we find our radial pulse. Perfect. And then we're going to look for his ulnar pulse on the opposite side. It's a little fainter, but it's perfectly normal for that to be. And then we're going to perform the Allen test using both of these. So, Michael, I'm going to ask you to make a fist for me. Perfect. I'm going to make sure that I collapse both arteries. And you're going to open your fist. You open your hand. Perfect. As you can see, his hand is completely blanched. Now, the Allen test, a positive one, would be an abnormality in it. So I'm going to release his ulnar. And within 6 to 7 seconds, we should see our color come back into his hand. And then the full color will come back with his radial being released as well. All right, so in the next part of our arm exam, we're going to be checking for the nodes as well. So Michael, if you can just lift your arm for me, please. I need you to, like that, perfect. So here we're gonna check for the epitrocular node, I'm sorry. So we're gonna do circular motions to palpate. Usually they aren't palpable, which means that there's no inflammation and we should be good to go there. Here, into the axilla, we're going to check for the central axillary node, which will be over here, circular. No inflammation, not palpable. And then in this area as well, we would check for this one is the central. The original one was the lateral. And we're just doing circular motions to make sure there's no inflammation as well. For this part of the peripheral vascular exam, we're going to be inspecting and palpating the inguinal nodes and making sure that we can check our bilateral pulses of the femoral pulse, popliteal, dorsalis pedis, and the posterior tibial. And we'll be also checking for edema. So starting off, we have our patient lying down supine here on our exam table. We ask them to, usually for privacy purposes, we would have them draped over, making sure that we can inspect certain parts of the body for the nodes or whichever pulses that we're going to be observing. Currently, for the sake of our simulation, we won't be doing that. So let's begin here. We're going to show us horizontally and vertically down our inguinal node, which will be in this area right here. Then we're going to be checking for our pulses, which would be where the thigh muscles meet the groin muscles, which would also be around the same area here. And we'll also, for the popliteal pulse, Michael, can I just ask you to put up your knee just like this? It would be behind his patella right over here, which would be here. It's a little harder usually to palpate this pulse, but for argument's sake. Then over here, we're going to be seeing his foot. Usually, we're going to look for the dorsalis pedis pulse, which would be just medial of his tendon right over here. And then our posterior tibia pulse would be on this side, right around, hooked around his malleolus, tibial malleolus. So now we're going to be inspecting for edema. Usually these can present on the shin or on the dorsal part of the foot. So what we do is we always make sure we take a bilateral approach. We're going to check for pitting edema, which would put a firm push into the area that we are checking for. Looks like it's negative for edema, perfect. Over here we would do the same thing. However, for argument's sake, this is just the technique that we will be doing. We rate edema on a scale of 1 to 4, and that's based on the depth and how long it takes for the edema to become back to normal. So we can conclude from the peripheral vascular exam that there's no extremity edema or color changes that were noted. Normal lower extremity hair distribution bilaterally. Calves are supple, non-tender. There's no varicosities, stasis, pigmentation, or ulcers. Radial femoral and dorsalis pedis, posterior tibial extremities. Their pulses were 2+. 2+, I did forget to mention, there is a scale from 1 to 4. 2+ being normal, 3 would be 1 to 3. I apologize. 3 being pulsing and very prominent and very abnormal. Cut it. So part of our neck exam, we're going to inspect as always first, and then we will palpate. So we're going to be checking for masses, scars, any deformities, and swelling. We're going to do that right now. Just can you lift your head up like this? Perfect. Neck looks great. Everything looks symmetrical. There's no deformities or swelling. We're also going to check his trachea right here in the middle. Doesn't look like there's any deviations. What we do here is we do cross-lighting. This is when we're inspecting the thyroid. So what we do here is we're just checking to see that, making sure that the size is appropriate. And we're doing the same thing on the opposite side. Perfect. And we're going to do a swallow test as well. Can you just drink some water for me, please? Sure. I'll tell you when to swallow, all right? All right, so right here, we're just going to observe that, making sure everything goes. If it's hard to swallow, you can just put your head down a little bit. Perfect. You swallowed already? Okay, you can swallow now. As you can see, the thyroid and the cartilages went up when he swallowed, and it went back down to its normal position as well. So as we continue on with our examination of the thyroid, all we're going to do is we're going to get behind the patient. This is however comfortable the provider is in whichever position. I'm going to do it posteriorly. What we're going to do is we're going to be feeling around. Here we found our trachea, making sure that using before when we did our cross-lighting that we're feeling in the correct place. We're going to displace the trachea. We're going to make sure we're in the right place. We're going to displace the trachea to one side. I'm going to move his trachea to the left, and I'm going to use my left hand to feel the lobe of his thyroid as well. Make sure that make sure it's symmetrical. I'm going to do the same thing on the other side. Perfect. The nodes are symmetrical and there's no abnormalities here. So we're going to now palpate our nodes that we would find in the head and neck area. So if you can just get closer, we're going to start off with the preauricular, circular motions, make sure there's no abnormalities. Postauricular right over here. We're going to go occipital as well. Coming back to the neck, we're going to go tonsillar, submandibular, and then submental. Now we're also going to, can you just shrug your shoulders for me? Perfect. So what we do here is we're going to look at the clavicle. We're going to be here, supraclavicular. We're going to look for the nodes here. Most of these nodes, as mentioned before, are non-palpable. You can put down you can unshrug. We're going to check for the anterior, posterior, and the deep cervical lymph nodes. So anteriorly, we look over here, posterior behind, and then deep, you would go a little bit deeper palpation over here. Fine. So as we begin our ENT exam, we're going to be first inspecting the eyes. This includes first inspection of the anatomy, which would be our eyebrows, the eyelids, the eyelashes, the conjunctiva, the sclera, and the cornea. So looking at our patient here, looks like everything is within normal limits, and we can go ahead and begin palpating, which would be our nasolacrimal ducts. Is there any tenderness here, Tim?
Nope.
No? Perfect. We can move on to the next portion of our exam, which is the visual acuity. Can you just cover your right eye for me, please? Perfect, thank you. Can you just read, what is the lowest line you can read from this chart?
LEFOD-PCT.
Perfect. Can you just cover your other eye for me? And go ahead and read the lowest line that you can see.
LEFOD-PCT.
Perfect. Now you can just put them both down and just read it, the lowest line you can see.
LEFOD-PCT.
Perfect. So he has a 20/20 vision, and we can continue with our eye exam. The next part of our eye exam would include testing for the visual fields, and the next part of our eye exam is going to include testing for the visual fields of our patient. We will imagine a glass bowl over him, and we will test each eye individually to check to see his perception, his peripheral vision through this test. So can I just ask you to cover your left eye for me? Perfect. I'm just going to test here. This is going to test his right eye. So let me know when you see my fingers moving, okay?
Good. Good. Good.
Perfect. You can switch eyes. I'm going to start from the top, okay?
Good. Good. Good.
Perfect. And I'm going to cut this, but do both. Like, using both your eyes to check the food?
No, that was good.
It was just one and one, right?
It's hard to.
Sounds good, you can cut it. So the next part of our physical exam of the eye is going to be testing for the pupillary reflexes. First we'll be checking each pupil individually, then we'll test both via confrontation. So Tim, I'm just going to ask you to look forward for me. So right here we're just looking to make sure that his pupil will constrict, and it does. We're going to make sure on the other side as well. Perfect. And now when we go sliding across, we just want to make sure that there's no dilation in between. Perfect. And then also what I was doing was looking to make sure that once I'm on one eye, the other eye does not dilate, because that can be a sign of a more serious condition. So the next step of our eye exam will be testing for extraocular movements. Usually we take an approach of drawing an H and making sure that they stay in a stable position, their head does not move, and that they just follow our fingers. So Tim, if you just do me a favor, just follow the fingers, don't move your head, okay? Perfect. Looks like his extraocular movements are within normal limits. So the next portion of our exam would be the fundoscopic exam. This is usually done in a darkened room. We will be checking both of his eyes. We're just going to check for the veins, arteries, we're going to check for the light reflex, and we're also going to check for his optic disc as well to make sure there's no abnormalities. So we're going to start right here, right eye to right eye. So we just adjust. We adjust for, I wear glasses normally, so I have to adjust this from myself. So we get closer. I see the red reflex from a distance, and then as we open, can you just open your eye just a little bit more? Perfect. And then we get a little bit closer, we can see the arteries and veins, and I can see his optic disc as well. So we're going to do the same thing on his left side. Right, there's the red reflex. As we get closer, still at this angle, we see the optic disc, and we also see the arteries and veins inside as well. Eyelids are normal in appearance without any swelling, scaling, or lesions. Visual acuity was 20/20 on both his right, his left, and bilaterally when we tested that. They're without any corrective lenses. Conjunctiva was pink, sclera was white. There was no icterus, injections, or exudates. Extraocular movements are intact, and visual fields are within normal limits. As we continue further into our exams, we're going to start with the ear exam. We will be inspecting and palpating multiple portions of the ear. We're going to start with the auricle, and then we will also start with, continue with the tragus and the mastoid process. So we can see here, if you want to just get a little bit closer. So right here, we're inspecting first. This is the tragus, the auricle, and the mastoid process is over here. Looks like everything looks fine. We're going to be inspecting, palpating as well. So any tenderness? Right, any tenderness?
Nope.
All right, and any tenderness over here?
No.
Perfect. So with that, we're going to also be doing the tug test, where for adults, we pull up and out. For pediatrics, we pull down and back. All right, so we're going to go back. Any sensitivity, pain, anything like that? Perfect. All right, you can. Next portion of our exam, we'll be doing a whisper test where I will be whispering a word, and I just want to make sure that he can repeat the word back to me so I know that he's hearing it correctly. Okay?
Zebra.
Perfect. Whisper test was negative. Good enough. Weber's top of the forehead, right?
Mm-hmm. On top of the head.
Right. So the next portion, we're going to be testing for the Weber and the Rhine test as well. So a Weber test, we usually will take a tuning fork, we'll hit it against a hard surface, we'll put it on the middle of his head, and then we'll just check to see that the conduction is going well. Make sure it's equal on both sides. Rhine test is going to test to make sure that the neural conduction is going well as well, where we will hit it against the surface onto his bone. We're going to hold it onto his mastoid process, and then we will assess to see if he can hear it next to him. It's going to just test between bone and air conduction, basically. All right. So we're going to start off with our Weber test, and we're going to see, Tim, if there's any lateralization to any one side. If it feels louder on one end or another, just let me know, okay? We're testing to see if it sounds equal to you, so let me know about that as well. Does it sound equal?
Yep.
Perfect. Any side louder than the other?
Nope.
Perfect. So now we're going to move on to the Rhine test. Let me know when you can't hear it, okay?
Okay.
Do you still hear it?
Yes.
Perfect. Both tests were negative. So now we're going to be performing the otoscope exam. We're going to check for his ear canal. We're going to check for any redness, any discharge cerumen, if there's a buildup of cerumen. We're going to check the tympanic membrane's appearance, its color, the hand of malleus, and any cone, and the cone of light on the tympanic membrane. Right, so I'm just going to put this inside of your ear. We're going to hold it like this. We're going to hold the ear up and back. Hold on to his head.
Like the summer, it felt so much better. Like, go back to the summer. It's funny because I don't really like.
All right, perfect. We see the cone of light, and we also see the handle of the malleus, And it looks like there's a small amount of cerumen, but that's perfectly normal. The external ear and the ear canal are non-tender without any swelling or deformities. The canal is clear without any discharged tympanic membrane. It was pearly gray with a good cone of light bilaterally with no erythema or effusions. Auditory acuity intact to whispered voice.
Okay.
So as we begin our third exam, we'll start with inspection. We're going to be checking for the lips, the oropharynx, the hard and soft palate, and the buccal mucosa. So Tim, if you can just open up your mouth for me real quick. All right, so lips look like they are fine. They look like they are normal, no cracking, no lesions of any sort. The buccal mucosa is pink. There's no erythema cited. Perfect. And we're gonna check for the hard and soft palate. Perfect. Everything looks normal. A light pink color. We're gonna check his teeth, gums, and tongue on the lateral and the other underside. Can you just lift your tongue for me? Perfect. I'm just gonna smile for me, please. All right, so can you just hold down your lips for me? All right, and the bottom up. Perfect. Looks good. Alrighty, and we're also going to check for the pharynx and the tonsils. We're going to check for any lesions, erythema, edema, postnasal drip, or any exudates that we would find in that area. Just open up. We're just going to put this on the first third so that there's no gag reflex. Alright, just say ah for me. Alright, looks like tonsils are clear. Everything else looks great. So now we're going to be checking for Stenson and Wharton's duct. Stenson would be right here in the buccal mucosa. It looks like it's not that visible, so there's no inflammation in the area. And yeah, perfect. I just need you to lift your tongue. And Wharton's duct looks like it's fine as well. We did have this patient say ah before. That was also testing for the elevation of the uvula, as we were looking for the any differences in the tonsils as well. So usually we would palpate the tongue as well with a gloved hand and gauze. However, we don't have the resources available at the moment. So the oral mucosa is pink and moist with good dentition. The tongue midline without any lesions or fasciculations. No buccal or gingival nodules or lesions are noted. The pharynx is normal, and the appearance without any tonsillar hypertrophy, erythema, or exudates. The next exam is going to be the nose exam. We're going to first always start with inspection, where we're going to test for any deformities, any we're just checking for any trauma, asymmetry, discharge, inflammation. Looks like everything is normal. We're also going to be checking the patency of the nostrils bilaterally. Can you do me a favor? Can you just flare your nostrils open and close 2 times? Perfect. Looks great. Patency allows sufficient airflow. We're going to also check with the otoscope bilaterally. We're going to have the patient tilt their head back. Perfect. Thank you. It's fine. Keep being back. All right, cool. So I had the patient tilt his head back. We're not just going to be testing. We're going to be checking for any polyps, any lesions, discharge bleeding, septum, the turbinates. Make sure everything is in order. All right? I'll turn on our light. Just gonna lift your nose a little bit. All right. Looks like everything is normal. We're going to palpate both sides of the nose. Feel for any tenderness and masses. Any tenderness, any pain. All right. Perfect. While we're here, we're also going to go for we're going to palpate and the maxillary and the frontal sinuses. Do you have any tenderness here? What about here? All right. What do you smell?
Vanilla.
Perfect. Looks like his olfactory nerve is intact. The nasal mucosa is pink and moist. The nasal septum is midline. Nares are patent bilaterally, and olfactory acuity intact bilaterally.